Okay, it's up and going.
Is it? Okay, thank you. Well, it's 7 o'clock, so I'll call the Dunn County Board of Supervisors January 19th meeting to order. And we'll start with the Pledge of Allegiance.
I pledge allegiance.
Pledge allegiance
to
to
the
the
flag
flag
of the
of
United
United
States
States
of
of
America,
America,
to the
and
republic
to the republic
for
which
which
stands
under
under
God,
nation,
under
under
God,
God,
indivisible,
indivisible,
Justice
with
for all.
liberty and justice for all.
Thank you. We'll have the clerk call the roll.
Supervisor Johnson.
Here.
Supervisor Headland.
Here.
Supervisor Score.
here,
Supervisor Steen.
here,
Supervisor Zons.
Here.
Supervisor Gary Bjork.
here,
Supervisor Maves.
Here.
Supervisor Quinn.
Here.
Supervisor Rogers.
Here.
Supervisor
Here.
Anderson.
Here.
Supervisor Kinnear.
Here.
Supervisor Cromrie.
Here.
Supervisor Calabrese.
Here.
Supervisor Keeter.
here,
Supervisor Vogel.
Here.
Supervisor McCullough. Supervisor Story.
Here.
Supervisor Vandermeulen.
Here.
Supervisor Niehoff.
Here.
Supervisor Morehouse.
Here.
Supervisor Tripp.
Here.
Supervisor Prochnow.
Here.
Supervisor Jensen.
You're muted, Steve.
Here.
Supervisor Larry Bjork. Supervisor Bauer.
Here.
Supervisor Leno.
Here.
Supervisor Hartung.
Here.
Supervisor or Chairman Bartlett.
Here.
and Kelly, Supervisor McCullough.
And belatedly, I am here at least as long as my battery lasts.
Hey,
And I am here too.
we got you. All right, approval of the minutes. We need a motion for the minutes.
so move.
Supervisor Steen moves, Supervisor
Second.
Lanou seconds.
Oh, great.
Any discussion? If not, all in favor, say aye.
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 Opposed? Motion carried. Petitions, presentation of petitions, memorials, and other communications. We have recognition of retiring county employees, Lonnie Dodge from the ADRC, 21 years, Mike Owens from the jail, 26 years, Diane Bird, Social Services, 39 years, and Kathy Myers, DHS, 42 years. That's a combined 128 years of experience in service. It's outstanding. It's remarkable. It's just awesome. It's too bad we're losing all that experience in 1 month, but it's great for them to be able to retire. Any other presentations, clerk? All right, moving on to public comments. We have a number of them that were sent in by email, and the clerk's going to read them.
Today, January 19th, 2022, at 1:01 p.m., we had a communication from Carol Breslin that stated the following. Dunn County Board of Supervisors. While considering putting a new state of emergency in place for Dunn County residents, I would like to make a few points in opposition. Please hear these points with an open mind, as I am speaking not for myself, but for the good of our community. With the introduction of the Omicron variant, which according to most, if not all sources, is much more contagious, but much less severe and or deadly than any of the previous variants, the thought that we may even consider establishing a new state of emergency is confusing to me. In a September 16th, 2021 article by CNN found here, link provided, in the middle of the Delta variant, which was far more deadly than the Omicron variant, these 5 countries chose to open up and, quote, live with COVID, end quote. Denmark, Singapore, Thailand, South Africa, and Chile. To my understanding, none of these countries have seen either a rise in hospitalizations or death from the COVID virus, regardless of variant, vaccination status, or mask mandate. Since that time, France, Scotland, Ghana, Nigeria, and other countries have dropped or greatly reduced their COVID response protocols with no negligible increase in hospitalization or death. Just this morning, Boris Johnson, speaking to the House of Commons in the UK, announced that Plan B measures will be allowed to lapse next Thursday, January 27th, 2022, essentially ending all mandatory COVID measures. No more work from home, no masks, no vaccine mandates, nothing. There are many states within the United States of America that have chosen to end their COVID protocols at different times over the last 2 years, none of which have resulted in significantly increased hospitalizations or deaths. I won't bore you by listing them. We know that they are other states and municipalities that have had that have held more dearly their constitutional rights than we in Dunn County have. I apologize. This is the real meat of my message to you. You are a significant part of our local government, and as such, you have been elected not only to speak for us, but to listen to us, hear us, and make decisions based on the needs and wishes of your constituents. This has been a difficult time for everyone, including our representatives, and I respect and appreciate that, but I'm asking you to vote this evening using common sense, a cool head, the real data, and a sense of respect to our God-given personal freedoms. As Thomas Jefferson said, if people let the government decide what foods they eat and what medicines they take, their bodies will soon be in a sorry state, as are the souls who live under tyranny. I will submit to you that the residents of Dunn County, having lived under the cloud of COVID for the last 2 years, have armed themselves with the mitigation strategies that work for each of their individual families, and no longer rely on our elected representatives for either guidance or protection. Please remember this when voting this evening. Thank you. Carol Breslin, resident of the town of New Haven in Dunn County. On Wednesday, January 19th at 1:47 p.m., we received the following communication from Brittany Weaker. I wish to have my letter read as a public comment at the meeting tonight. A resolution declaring a state of emergency is unnecessary. The definition of emergency is, quote, a serious, unexpected, and often dangerous situation requiring immediate action, end quote. This is not what we are experiencing with COVID. As I sit here writing this email, I am in quarantine with my family. This is my family's second time testing positive. It is barely comparable to a cold. The most common symptoms of Omicron are runny nose, sore throat, and mild headache. How is this an emergency? My family has had to blow our noses a few times a day, and when my husband and I have taken ibuprofen once for a headache. What kind of immediate action needs to be taken for these symptoms? As of January 18th, the county had 9,746 cases and 63 deaths. There are 45,368 residents in Dunn County. 0.6% of people who have COVID have passed away, and 0.01% of the county's population have died while they have had COVID. Have we ever used these tactics for the flu? Not that I can recall. We need to bring back common sense and stop the fear and panic. Our citizens are able to make good decisions without force from the government regarding their health and healthcare. A couple of months ago, Menominee schools decided that students who had close contact at school could continue to come to school unless they had symptoms. No mask or test required, just come back to school. I got an email that my son had close contact. My husband and I decided to be responsible, even though he had no symptoms. And we have our son tested and wear masks until we got the test back. We had him tested in the next morning and went to drop him off at school. We were then informed that if you have a test in progress, you're not allowed to return to school. So because of the rules set forth, my son could have returned to school without a mask or test, but because we were trying to be responsible and had him tested, regulations required him to miss a full day of school. This is the kind of regulation that comes from a state of emergency rushed mindset and not using common sense approach. Please do not continue with the state of emergency order. Thank you for taking the time to listen to my concerns as a voter in Dunn County. Brittany Weaker, City Menominee resident. On Wednesday, January 19th, 2022 at 2:42 p.m., we received a communication from Jeff Keys. To whom it may concern, I'm opposed to declaring a public emergency for the COVID-19 situation. I have spent 25 plus years in the safety and health profession, and of those years, many performing industrial hygiene. From my experience, the COVID protocol is too small, and today masks do not trap out the aerosolized particles. COVID particles are less than half the size of a particle from cigarette smoke. When doing research, you can find the COVID particle is 0.06 to 0.14 microns in size. An N95 loses effectiveness at particles less than 0.1 microns. Look it up. Cloth masks are absolutely ineffective. In my opinion, they are bacteria-infested contaminants. Respectfully submitted, Jeff Kies. On Wednesday, January 19th, 2022 at 4:31 p.m., we received the following communication from Scott Johnson. As a citizen of Dunn County, Wisconsin for over 40 years, I would like to express my studied position against any government regulation or ordinances requiring the wearing of masks for COVID-19 and its current variants under penalty of law. I am a retired past certified safety professional, CSP, have an MS in industrial safety, and practice my safety and health craft with 3M for 25 years. I was unaware of tonight's vote, so please forgive the timing of this correspondence. Thank you for scanning the attachments as if you are able prior to this evening's resolution and vote. Sincerely, Scott Johnson, N7177 80th Street, Knapp, Wisconsin. On Wednesday, January 19th, 2022 at 4:41 p.m., we received the following communication from Barbara Black. Please call out the state of emergency for Dunn County. Even CDC knows it is not a state of emergency. Respect your constituents. Thank you. On Wednesday, January 19th, 2022 at 6:41 p.m., we received the following communication from Josie Pillman. Ladies and gentlemen, on the agenda this month as a, quote, resolution declaring a state of emergency, end quote. I'm not in favor of a declared state of emergency in our county, excuse me. I spoke with my Board of Supervisor trustee, Tom Quinn, for quite some time this morning. I was trying to understand the history of why the state of emergency was ever enacted the first time. I was trying to understand what research and discovery the board has done on which to base this decision. I have been doing my own observation and studies and research about the COVID-19 virus. I have been learning that much of what we once thought was simply the case is not. For example, 1, masks do not stop the spread of the virus as much as we wish they did. They do not. Furthermore, they are actually medically unsafe as they catch the bacteria in the mask, which is then breathed back into the victim. They are very psychologically dangerous to children as well as adults. They propagate fear. Fear is a very treatable virus. Fearful people do unreasonable things. 2, COVID is treatable with ivermectin and HCQ when given early in the treatment, as it slows down the replications of the virus. Everyone should have it on hand when the virus comes knocking, and it will. Most people will be able to avoid hospitalization when COVID is properly treated. 3, children and the whole population should be taught to boost their immune systems in order to be well armed so that their own wonderful immune systems can fight off the virus. This involves taking vitamin C, vitamin D3, zinc, and quercetin. Quercetin is the gun that shoots the zinc bullet into the cell. Take these victims as prophylactic. It's a prophylactic. Remember that COVID will come knocking, and we want our bodies to be well prepared to fight it off. How about pushing dishes of vitamins at the doors of our public buildings rather than masks? 4, when we have a cure for a disease, we do not need a vaccine. The vaccine has risks, especially to children and adults of a reproductive age. This should never be mandated for anyone, and that means no one, whether you work for a private company or you work for the government, should risk losing the job because they refuse to submit themselves to a possibly dangerous vaccine. 5, COVID recovered people have a higher immunity to COVID and all its variants than any vaccinated or boosted person. Our own wonderful natural immunity will do its job. Then we will soon have herd immunity and COVID can be treated like any other flu or virus. Check out Dr. David E. Martin as you do your research. Remember, you are making policy decisions that affect the whole of Dunn County for better or worse. Be wise and please be discerning. Thank you for your listening ear. Respectfully, Josie Pillman, 235-3 3rd Avenue East at Knapp, Wisconsin. And the final communication we received came in Wednesday, January 19th, 2022 at 6:41 p.m. from Bobby Stokey. I have lived in Dunn County District 28 for the past 15 years. I'm a parent as well as a grandparent. I understand the board is considering another mask or lockdown resolution for Dunn County. I'm asking you to vote no to mask or lockdown measures and consider other reasonable solutions included below. If the past 2 years have taught us anything, it is that masks and lockdowns are not the answer. We simply wouldn't be having the conversation if they did work. One does not need to look very far to see that masking an entire population is not effective. A quick example is the shutdown of entire elementary school classrooms in Menominee schools 3 weeks after imposing mask mandates. Clearly, we're not going to mask or lock down our way out of the pandemic. Instead of masks and stripping people of their constitutional freedoms, let's start educating the residents of Dunn County on how they can prevent, reduce, and treat illness on their own at home so that the medical community is not overwhelmed and can treat people who need it most. The current message does not provide people with simple, over-the-counter prevention and early treatment remedies that can be done at home and found in stores right here in Dunn County. One example of at-home treatments is from Dr. Joseph Marola, who has successfully treated thousands of patients with COVID-19 using this protocol. All of his treatments are all over the counter and non-prescription. I have shared this information with my friends and family who have successfully used this protocol on their own to recover not only from COVID-19, but colds and flu as well. Most items in the protocol can be found at Menominee Co-op or in other stores in Menominee. To read Dr. Mercola's protocol, please click on the following link provided. Dr. Mercola is not the only resource. There are several other medical doctors such as Frontline Critical Care Alliance that also provide prevention and early outpatient care to keep people from overwhelming the medical community. See the prevention and early outpatient treatment protocol below. Sharing successful early outpatient treatment remedies with residents of Dunn County will help residents overcome illness on their own and keep the medical community from being overwhelmed. COVID-19 is not going away. Residents can choose to wear masks on their own, but as a whole, mask measures and lockdowns clearly are not effective, ruin our economy, strip residents of civil liberties, and destroy our public education. It's time for a different approach. Give the residents of Dunn County information and resources to treat themselves early, effectively at home, without prescriptions, based on the research from medical doctors instead of spreading fear. Please vote no to masks and lockdowns. Thank you. Bobby Stokey, N4959 577th Street in Menominee. Thus ends the public communications.
Thank you. Moving on to appointments to the ADRC Advisory Committee. Appoint to succeed Margaret Steinecker, Christian Olson. And that needs board approval. So I need a motion to confirm that. Supervisor Steen moves, Supervisor Morehouse seconds. Any discussion? If not, all in favor, say aye.
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 Opposed? Motion carried. To the Local Emergency Planning Committee, I'm not going to read the names that you've got them on your list. There's three names there of people that their terms haven't expired yet. This is a list that Stephen Finley sent us of the ones that were. So we're just reappointing or appointing the ones that did expire 12/21. The other three will be appointed or reappointed later. And those are chair appointments. Also to the Farm Drainage Board, term expires December 2024, reappoint Tom Forrester, and that's the circuit judge's appointment. So we don't do anything, but I'm letting you know for your information. Moving on to 8, the report of the county manager. We'll start with a COVID-19 update, please.
Thank you. This information was shared in email to Dunn County email recipients on Monday, but it does represent the latest information that I have regarding COVID-19 in Dunn County. We are currently experiencing a major surge, the highest surge that we have had for the entire period of the pandemic. There were 662 new cases of the virus confirmed in the past week. There's a significant jump from one week to the next. There's another 1,550 probable cases. Those are antigen tested. It is significant that the average number of cases per day over the last 7 days is 117, which exceeds the highest one-day total we saw at the peak of the last surge in November of last year. So it is, in fact, something that we are seeing a significant uptick. And that's part of what I think the resolution you're going to be discussing is intended to address. The vaccination rate in the county is barely moved. Only 46.8% of the population have received 2 doses of vaccine. We've had outbreaks in our jail. We've had outbreaks among county staff associated with county staff activities. So the suggestions from our public health department for everybody remaining safe, they are encouraging to limit travel to only what's necessary, to avoid high-risk situations, that's attending crowded events or venues. And the health department does encourage wearing a mask when you're outside of your home, maintaining proper social distancing, etc. So that is the status of COVID-19 as the information has been given to me to date. I don't know if there are any questions.
Any questions on that at this time?
Supervisor Bjork has his hand up.
Supervisor Larry Bjork.
He's muted.
And you're muted, Larry. There you go. Nope.
You muted yourself again, Larry.
Yeah,
Hold down your space bar. There you go.
Will there be a recommendation as far as the upcoming Red Cedar Watershed Conference? They just barely got in under the wire last year. Are you going to be encouraging board members to go with per diems this year, or because we are, will it ask us not to?
That's a simple answer, Larry. That conference has been canceled because of COVID.
Thank you very much.
Any other questions? Tim?
Yeah. Paul, has there been any information regarding the testing of the sewer systems in our local communities as to where the numbers are for the virus concentrations or loads?
I do not have access to that information, Supervisor Lee, now, but I can pass the inquiry along to our public health department.
All right, thank you.
Supervisor Calabrese.
Thank you, Mr. Chairman. Are there available numbers for the outbreaks in the jail and the neighbors of how many of those were hospitalizations?
I have not heard, Supervisor Calabrese, of any hospitalizations from those outbreaks. I did hear that anywhere from 75 to 90% of our jail population did contract the virus. It also put severe staffing shortages that had to be coped with at the jail. I understand we had We have 2 houses, I believe, and at the neighbors that are still in outbreak mode. And we've had a number, obviously, of staff that have been in and out as a result of that. We had 1 case of transmission from a visitor to the neighbors, resulting in an infection of a resident, but I'm unaware of any hospitalizations.
Thank you.
Any other questions?
I have a question.
Supervisor
I
Bauer
was wondering,
or Supervisor Jensen, excuse me.
yes, I have a question of Paul. I was wondering how many of the residents and inmates had been vaccinated? If he knows that.
I don't know the exact numbers. I know that at the neighbors, a large percentage of the residents are vaccinated. I don't know the vaccination rate of the jail population, unfortunately.
Any other questions? I can only see about half of you at a time, so I keep switching. So if I miss somebody, please speak up and say you have a question. I don't see any more, so Mr. Miller, you can move on.
Thank you. Some better news. I wanted to take the opportunity to introduce to the county board and those watching the meeting, our new Chief Financial Officer, Beata Haug. Beata has been with us now for, 2 weeks. Feels like a long time. She comes to us from Washington County in Minnesota, but actually in her past, she worked for Dunn County in our Department of Human Services. Came to us with a great deal of experience and expertise. We were very pleased to get her on board and come to agreements. Beata is with us this evening. Beata, do you want to take a moment to introduce yourself to the county board? You're muted. There she is.
Yes, good evening. Thank you so much for giving me this opportunity to introduce myself. I think Mr. Miller did a really great job covering my overall experience. Like as he alluded, I've been at multiple counties. I've been in the government sector since 2003. And I've been at multiple counties, mainly through western side of Wisconsin. And as far as Minnesota, Stillwater, which is the Washington County. And as I've been going through my journey, I've collected a lot of knowledge. So I'm really excited about this opportunity because my expertise does include process improvement, policies, procedures. It's internal control, something that I'm very passionate about and something that I plan on incorporating at Dunn County to take us to a really good, successful level. So thank you again for having me. I really appreciate it.
And welcome to the county from the county board.
Thank you. I had the privilege to meet many of you already in previous meetings, and some of you are new faces to me. So you know where my office is. By all means, you're always welcome.
Right, thank you.
Thank you.
Mr. Miller, you can go on to the purchase orders.
So in your packet of materials for today's meeting are the purchase orders over $40,000. I think that most of them are fairly self-explanatory. Highlight under administration IT, the Google Apps annual maintenance cost of $80,000. It's for the various suite of Google programs that we use, Gmail and calendar, et cetera. So that's an annual maintenance cost. But if there are any questions regarding the purchase orders, I'd be happy to try to answer.
Supervisor Bjork?
Larry Bjork.
I just wanted to know, the Haas and Sons, of course, came before us before. And was this the same amount or a different amount?
That's the amount that was agreed to for the settlement.
But my question was this the amount that was settled, that was agreed on, that we had okayed previously? I thought
Yes.
it was more.
Yes, that is the amount that the county board agreed with Haas and Sons as a settlement. It's one payment.
Okay, but I mean, when you say as a settlement, is the settlement to Is it the same dollar amount from the previous payment?
I'm not certain I'm following Supervisor Bjork. We
Are
had an
you,
orig-
are you asking Larry, is this what the invoice was?
Yes.
This is lower than what the invoice was.
Okay, that's my question.
Okay.
That's my question.
Apologize for not following.
Excuse me, Supervisor Gary Bjork.
It's been a while since I looked at those, like over $40,000. But one thing I kind of questioned, it said for road work in Knapp on Highway 29, but I always associated Knapp with Highway 12. Did I misread something or misunderstood something on that?
Good catch.
That's, that may be a typo. I can clarify it for you.
Okay, thank you.
Yeah, 29 doesn't go through Knapp, so
So it's probably Highway 12.
it could be.
That or not nap.
Maybe we can get confirmation from that and maybe an email sent out to everybody after we check with Dustin.
I will do that.
Any other questions? That was a good catch, Gary. I didn't notice that. Moving on to reports of the departments. Tonight, we have a written report in your packet from the Dunn County Housing Authority. We also have Tammy Joy Lavera here tonight. Tammy, would you like to add anything to your report? Or do you want to just take questions?
I guess if I can just opt out to just take questions, that sounds great to me.
All right. That's what we've been doing lately with these reports. Is there any questions about the Housing Authority report?
Mr. Chair.
Supervisor Kinnear.
Tammy, these are really great programs. I'm just curious, do you have difficulty in getting people to apply for these two
No.
programs here that you mentioned?
No, we go through probably 300 to 400 applications a year.
And out of those applications, are you able to get enough to qualify so you can fill up your slots?
We actually haven't had our vouchers full in quite a while. We're using the entire budget. However, we could go above budget and serve more. There's not a lot of affordable housing or even housing options in Dunn County, period, for the vouchers to be in full use. So even though we are expending our full budget, we could exceed that and get more money if there were more housing options for our applicants.
Thank you very much. That kind of broadens the picture, doesn't it? Thank you.
You're welcome.
Are there any other questions?
I have a question for Tammy.
Supervisor Jensen, go ahead.
What is the percentage of people that apply that get housing?
Whew, I don't know offhand what that percentage is, but it's very low. It's a really good question, Steve. I would say that it's probably, we're probably at maybe 5%, because like I said, we have like 300 to 400 that apply per year. And of course, you have to also understand that about 45% of those never respond. You know, they fill out an application, and then when their name comes to the top of the list, we don't hear from them again for a variety of reasons. They might not even be in our county anymore, especially if they were homeless. You know, homeless people don't always stay in the same area. So of the people that actually respond and come into meetings, the percentage is a little bit more, but of applicants, it's probably, like I said, maybe 5%.
Okay, thank you.
Any other questions? If not, thank you for the report and thank you for being here to answer any questions. I will
Sure.
put plug out for their annual meeting. I know it's in December, so it just was, but I attended this year and it was very informational, very interesting. So if you can remember and you have time next year when it comes around, I would suggest that you take in that annual meeting.
And if you have questions in the meantime, you can definitely reach out to me at the office anytime.
All right, thank you. Moving on to number 10, consideration of resolutions, reports, ordinances from the standing committees. From the Committee on Administration, a resolution approving a labor agreement with the powers of arrest employees. And I need a motion for this. Supervisor Story moves, Supervisor Lanu seconds. Speaking to this, Supervisor Headland, did you want to?
I could start. Thank you, Mr. Chair. Correct. This is an agreement. I believe it's a 3-year agreement. Is that correct?
2.
And with the powers of arrest, it's the only union left in the county that we have a full employment agreement with. And I've been looking at the preparation that was presented to the committee administration by our personnel staff, HR, and our county manager. I thought that they did an excellent job in negotiating with those people. I think we have a good rapport with them. There was certainly no unjustified requests that I could see. And the amount of settlement that we came to an agreement with them overall for the period, I thought was very fair. I didn't see any red flags, in my own opinion, that maybe feel like one side or the other was doing anything wrong. I think it was a very mutual and satisfactory agreement, and glad that we were able to come to such a just agreement for a good bunch of county employees. Thank you.
Thank you. Any questions? Do you have anything to add, Mr. Lang
No,
or Mr. Miller?
no, it
All right.
is for 2 years.
Okay.
Any
Mr.
questions?
Chairman?
Yes, Supervisor Gary Bjork.
I went over it like pretty fast, but I didn't see any percentage raises for the first 2 years. Do you know, can you tell us what the percent raise was for each year? It might have been in there, but I missed it.
Mr. Lang is looking that up so he can tell you exactly right
Well, I'm gonna try and get as close as I can.
now. Oh, as close as he can.
The very last page of the attachment, page 31 of the agreement, which includes the main labor contract and then some side letters, contains the wage schedules that would come into effect. I can't remember the percentage, but it was comparable to what other county employees received as a result of adjustments made in October and then adopted in the budget in November. 5%, 3%. I think it was, yeah, 5% and 3%. And one of the ways that we accomplish some of this is to the starting wage. And I think there was a 6-month or starting wage, 12-month, 18-month. So the lower 2 or 3 steps were dropped off the grid, and 1 or 2 steps was added to the top end of it. That helped us elevate the grid without having all of the steps in the grid increase, but then not have anyone that they would apply to. Many of our deputies have been around for a while. And I think it was 5% for the first year and 3% for the second year.
Thank you.
Any other questions?
Yeah, I have a question.
Go ahead, Supervisor Jensen.
I was wondering if after the 5 years, that is the limit, or after that it's negotiable, or how does that work?
Well, it's kind of, there's a dynamic relationship. So the labor agreement is only for 2 years. And so the 5 years in the schedule will apply to all employees, but in 2 years' time, a new 5-year schedule will be implemented. Employees that are at the top of the grid already will experience a pay increase, but they're not going to keep making steps beyond the top if that's where they're at. So at 60 months, for example, at 60 months, the hourly pay rate is $33.02. And so that would any employee that's been here for longer than 60 months would continue to receive that rate, but for 2 years. And then in 2 years' time, there's likely to be an adjustment made based on the current economic factors that are present at that time.
I will add that every time we would negotiate with the union, part of what drives it is the current makeup of our deputies. If you have those with longer tenure, then you tend to look at adjustments for a body of employees that have that tenure. If you have more newcomers, it tends to shift back down toward the lower or initial steps. So this 2-year contract, the bottom line is everything basically is potentially on the table when we sit down again, including the pay grid. And it'll depend on the mixture of employees and their tenure and their priorities at that time.
Okay, thank you.
Any other questions? So, any other questions? Okay, I don't see any, so. Would the sheriff like to add anything to this before we vote?
No, I think it's a good contract. And I think it will certainly help with recruitment and retention. And I just want to clarify, I'm pretty sure it's a 6% increase on the first year of the contract, a 3% increase on the second year of the contract is what they settled. And I think that'll certainly put, give us some assistance for recruitment and retention. We put deputy applications out and we used to receive, 60 to 80, and we're lucky if we get 10 qualified applicants now. And it's a very competitive market. Eau Claire County is paying more. St. Croix County, Polk County are all paying more, and even Menominee Police Department. So we're in competition with trying to get good quality employees, and this will certainly help.
Thank you. Well, I don't see any other questions or discussions, so all in favor of passing this resolution, say aye.
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 Opposed? Motion carried. Thank you. Moving on to 10B, this comes from the Planning Resource Development Committee. It's an ordinance repealing and recreating Chapter 16 of the Dunn County Code of Ordinances. This is the second reading. We had a motion and a second last month at our first reading. So are there any questions or any speaking to this? Supervisor Quinn. And you're muted, Tom.
I'm sorry. Thank you. As you pointed out, just a brief comment that this is the second reading. The committee worked on this ordinance for a long period of time, almost a year. We had a public hearing on October 27th. I think this is an ordinance that deals not with land use, but with land division, how you divide parcels. It's a particular concern to the non-zone towns in the county because it's one of the places where the county exercises some authority over land use. And I'm happy to say that we had some concerns raised by those towns, and they provided a organized effort to work with the committee to resolve those issues that they had. And in the end, ended up agreeing and supporting the amendment. So I hope we can pass it tonight and get it on the books.
Any other questions or speaking to it? I don't see any. So all in favor, say aye.
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 Opposed? Motion carried. Moving on to 10C. This is from the Health and Human Services Board. This is a resolution adopting the Cdbg Citizen Participation Plan. I need a motion for this. Supervisor Morehouse moves. Supervisor McCullough seconds. Speaking to this resolution, Supervisor Morehouse?
Yes, excuse me. Yes, thank you, Mr. Chairman. The board has seen resolutions like this in the past. This is required by HUD and the Department of Administration for community development block grant funds that we apply for and receive.
Any questions? Oh, sorry.
No, that's all right. That's all right. That's probably enough.
Any questions?
Yeah, Supervisor Bauer here.
Okay, Supervisor Bauer, go ahead.
How long is this resolution for? 1 year, 2 years, or is it run?
May I, Mr. Chairman?
Yes, go ahead.
Yes, Supervisor Bauer. We've revised this slightly so that it will be in effect for other CDBG grants for which we apply. But you know, the specific grants of the housing study will be a one-time only grant. Does that respond to your question, Supervisor Bauer?
Yes, it does. But also I had a question on the complaint part of it. Let's see. I think it was on page 86. If you have complaints, you have to go to the county manager first. Then you list Paul as the county manager. Would it just be better just to have the county manager in case this doesn't go through for more years down the road and just in case something happens?
Well, I believe that this is stipulated in the administrative requirements. I don't know if Chris Corpola is on board. I believe that it is stipulated. And as you see in the citizen participation plan, the Health and Human Services Board is the is the responsible authority for citizen participation, including complaint.
Supervisor Quinn.
Thank you, Mr. Chairman. I wonder if Supervisor Morehouse could provide a little bit of explanation in plain language of what this is for, how it's going to be used, and how it's going to benefit the county.
The citizen participation plan or the housing study?
Both.
Okay. As you will remember, the Health and Human Services Board approved the housing study last May, and the entire county board approved the housing study in July. So this will be a robust opportunity for the county as a whole, for the city of Menominee and the village of Boyceville, who are partnering on the study, to get supply and demand data, to look at population projections, to look at needs. And especially we've asked the West Central Regional Planning Commission, the consultants on this, to focus in on policy considerations that the board might be able to take, or other partners in the community might be able to take to address what I think we all recognize as a fairly significant housing problem at the low end of the spectrum and at the high end of the spectrum as well. The Cdbg grant, for which this citizen participation plan is required, will support 2/3 of the cost of the housing study, up to a total of $50,000. The estimated cost for the housing study is $26,000. So that leaves, if the grant is received for 2/3, that leaves us about $8,000, which will then be supported by a grant from the Community Foundation.
Any other questions? Or Supervisor Quinn?
Thank you, Supervisor Morehouse. And just one other point, that as I understand it, the study is going to look at the whole county, and the opportunity for participation will be for all of the residents in the county, including the residents in the rural areas. Is that right?
Absolutely. That is correct. The village of Boyceville and the city of Menominee have agreed to come on for an additional cost. And that will be a deeper dive into issues specific, on the one hand to the city of Menominee and on the other hand to the village of Boyceville. But yes, it covers the whole county, and we are very hopeful that it's going to address a whole spectrum of needs related to housing.
Supervisor Morehouse, this citizen participation plan is something that we have to have in
Yes.
place so we can go ahead and apply for this grant for the study.
Yes, it is a required element.
So there are two different issues. One is that we need the plan in place to be able, that's the law. We need a plan in place to be able to apply for the grants. And then the next resolution up is for us to apply for that grant.
Yes, thank you, Mr. Chairman. There are two resolutions. The first is the citizen participation plan, and the second is the resolution approving the housing study and authorizing West Central Wisconsin Regional Plan to apply for the relevant Cdbg grant.
Are there any other questions? If not, all in favor of adopting a CBDG citizen participation plan, say aye.
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 Opposed? All right, thank you. Now we'll move on to 10C2 or 10B2.
10C.
10C, yeah, we have two Cs under 10, I guess, but the first C. Resolution authorizing the submission of the CDBG grant application. Now, this is to actually ask for the money. So I need a motion. Supervisor Morehouse moves. Supervisor Steen seconds. And speaking to this, maybe we've covered it already, Supervisor Morehouse. Is there anything you wanted to add for this?
No, I think perhaps we have. I'm anxious to move forward with the housing study. We've been talking about it a long time. I think it's going to provide very useful information for us. So unless there are other questions, I would just urge your support.
Any other questions?
Mr. Chair,
Yes. Who is this?
just a comment of, this really ties back to our first presentation by the Housing Authority.
Yes.
Some really good questions were asked of Tammy, and thanks to the board for asking them. But they brought out some very important points, so that we have a ton of applications and of people who want to be housed in Dunn County, but we don't have the housing for them, not the affordable housing, we don't. And so that's one reason that I think Boyceville jumped on board, and the state Menominee did also, is because there are this Village of Boyceville resident could get a county supplement to their housing. And if you live in Menominee, you could go under the Menominee Housing Authority and apply. So there's actually two different housing authorities in this county. But again, both of those housing authorities are limited in what the people they can take care of by the amount of affordable housing available. And it's in very short supply. Thank you.
Thank you, Supervisor Headland. I didn't get to say your name at first. I was on another screen. Yes, I was thinking that same thing, that it sure ties into what our annual report for the Housing Authority was. Any other discussion?
Mr. Chairman?
Yes, Supervisor Larry Bjork.
I had an opportunity to speak with the Housing Authority just a week or two ago. And, you know, it was sort of my maybe naivety that not knowing what's going on and thinking that I'm hearing about these building projects that are going on. I know there's a big one in Elk Mountain, and there's another big one in the Menominee area, that automatically, because you have more units available, that doesn't really say much as far as having it low income housing. And in fact, it was my understanding with the discussion I had that bringing on these new housing developments with higher rental rates then really even bumps up the rental rates of the existing housing. Is that right? I mean, even though we're getting more units housing available, it's driving up the cost of housing?
I can't answer that. Supervisor Morehouse is going to try.
And Mr. Chairman, no, I can't answer the question specific to the generalized rate of increase in housing. I do know that development has recently been approved by the city of Menominee that has a specific policy directed set aside for low income housing. So until and unless that sort of thing happens, it is probably not likely, or maybe even economically sustainable to offer low income housing. But this new development, I don't remember the completion date, does set aside a fairly significant portion of the housing stock to low income persons.
Okay, thank you.
Any other questions? If not, all in favor of approving the submission of the CDBG grant application, say aye.
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 Opposed? Motion carried. Now we'll move on to 10. of the second C from the executive committee, a resolution rescinding 2013-13 and establishing the highway department, facilities department, and transit department. I need a motion for this.
So move. Mr.
Supervisor
Chair.
Johnson moves, Supervisor Steen seconded. Speaking to this, I don't know if Supervisor McCullough is still with us. He was a minute ago. I think we lost him. Would one of the vice chair of highway or one of the other highway committee members like to speak to this, or I will try to speak to it if you would rather? Supervisor Maves, go ahead.
Thank you, Mr. Chair. Yes, this is a resolution that will be rescinding the highway facilities and transits, because when it was under the Public Works, back when we tried that experiment, we thought that it would be a good idea, or it was voted to do that, to combine all three together. And it didn't work out the way we had hopefully planned. We ran into some issues that, anytime you have an experiment, there's unintended consequences. And so we, all three of the committees, the highway committee, the facilities, and the transit, decided to break apart the public works sector and create their own individual departments with their heads of each one. And so, and it did pass on all three different committees unanimously. So that's why we're moving forward here to reestablish the heads of each of those departments.
Thank you. Any questions?
Supervisor Kinnear.
Supervisor Kinnear, go ahead.
Thank you, Mr. Chair. So as I look at this list, are all the positions actually filled now with people that are working for us in the county? Or will we have new hires now?
We would have a new hire as commissioner. We have an interim commissioner.
Mr. Chair?
Go ahead, Supervisor Maves.
Yes, all three of these departments are being handled now on an interim basis, or just to fill in. So there will actually have to be a hiring process to fulfill, like you would normally hire. So right now it's just being done on a temporary basis.
Thank you very much.
If I may, Mr. Chair.
Mr. Chair.
Yeah, go ahead, Mr. Miller.
Just for clarification for the board's purposes, we have a director of our transit division, which will now be a transit department. There'll be no change there. We have a director of our facilities division, which will now be a facilities department. There'll be no change there. We have an interim highway commissioner. And in fact, that was one of the main reasons for breaking up the public works. We thought we would have more success in advertising for a highway commissioner than we would for a public works director. Public works directors are more typically municipal level and include not just roads, but sanitary sewers and storm sewers, water systems. And we don't have a water system or sanitary sewer system to manage. So we thought it would be more directed, and we would get a better group of candidates to fill our vacant highway commissioner position if we're able to advertise for a highway commissioner. That's another thing that's affected by this change.
Okay, somebody had a question. Supervisor Story.
Yes, regarding salaries, I think you answered it a little bit there, Paul, but it sounds like there will be no pay increases to those two departments you talked about. That would just be as they are now. They'll just have a different title.
That's
Is
correct.
that right? Okay, and then
I'm
go
sorry.
ahead.
Even their titles won't change.
Okay.
But no, there's no change in compensation for the heads of those two departments.
And then for the one that would be the one we're recruiting for, would that mean that salary will then be lower than it was before, since he wouldn't have as many responsibilities, he or she?
At this point, that has to be resolved. It'll depend on how we end up crafting the advertisement for the vacant highway position. And we have in front of us options. We could, in terms of whether we're doing a national search, a statewide search, interviewing people that are in the shop already who might, or simply promoting somebody. So that remains to be seen, Supervisor Story.
Is that something that you as manager would decide? Is that something that would come through executive or something that would come through administrative and human service? Human resources?
It would come through the highway committee first with the assistance of our HR department.
Okay, thank you.
And then, excuse me, and then the county board, because the county board hires the commissioner. Any other questions before we vote on this? If not, all in favor, say aye.
Aye.
Aye. Aye.
I,
Opposed? Motion carried. Moving on to 10C2, a resolution declaring a state of emergency. I need a motion for this. Supervisor Tripp moves.
I move we adopt the resolution.
And Supervisor Morehouse seconds.
If I might speak to the motion.
Go ahead, Supervisor Tripp.
What I would like to do first is hear from Katie Gallagher if she's here. And specifically, if she could respond to some of the comments that were provided for us at the beginning of the meeting. I want to commend the letter writers, by the way, because in addition to simply telling us what they want or didn't want, they gave us alternatives, they made suggestions, and I think we need to look at those suggestions seriously. Not being a scientist, I am going to rely on the recommendation of the health department. And so I think it would be appropriate at this time if the health department were to comment about those public comments.
I don't see KT here. KT, are you on this meeting?
She is not.
I'm sorry, Mr. Tripp, but she is not.
Mr. Chair, then
Yes.
Since she is not here, my vote has got to be with the Department of Health. They're the folks we hire as professionals to give us advice in exactly these situations. And notwithstanding, really, again, I commend the letter writers for their beliefs and their opinions. When it comes down to making a decision, I have to side with the health department. I will make one other very brief comment here, and that is, and I'm not trying to apply this to all of the information we heard, but at least in one instance, the comments were factually in error. Those N95 masks, if they are NIOSH approved, will filter out monodispersed particles at 0.03 microns. I too have some background in this. So in that case, at least when the letter writer cited 1.4 or whatever it was, that was in error, which again leads me to depend on our health service to give us the advice that I'm going to then follow. Thank you.
Supervisor Morehouse and then Supervisor Vandermoon.
yes, thank you, Mr. Chairman. I know that KT is obviously wildly busy. So I wonder, Mr. Chairman, with your permission, if we might hear from County Manager Miller, who is quite familiar and perhaps more familiar than any of us with the specific implementation of this emergency declaration.
All right. Why don't we let Supervisor Vandermeulen go ahead? He may have a question that. Go ahead, Carl.
Yeah, my question is, what's the scope of the resolution? The
the writers who were read earlier this evening seem to assume it applies to the whole county or to anyone in the county. As I read the resolution, it sounds like it applies only to county employees. And I'm sure Mr. Miller can clarify that.
That is correct. You are correct on that. Mr. Miller, do you want to?
Sure. Sure. I can confirm that as well, Supervisor Vandermeulen. The state of emergency is a declaration that recognizes what the county is experiencing with respect to COVID-19. But it is intended to apply principally to county employees, county buildings and facilities, and is intended to grant temporary authority for staff, your county manager, your public health director, your HR director, even your corporation counsel, in consultation with the county board chair to adopt additional protocols that may extend beyond those that we have in place now. It is not intended to be an emergency declaration that results in mask mandates for the general public, that results in stay-at-home orders, that results in restricting the size of gatherings indoors or outdoors. But it is a recognition that there is a high transmission rate, that although the Omicron variant is less virulent, it is more transmissible. And the balance is that if more people get sick, even if fewer of them get very sick, you still end up with very sick people. And that does have an impact on our local healthcare system. Earlier this month, we were down to 1 available ICU bed in the entire region. And we had a large number of our hospitals at full capacity and several on divert. That impacts all of us. So this emergency declaration recognizes that there is an ongoing pandemic, and that at least as far as leading by example, the county can do so by having the flexibility to respond in real time should the situation worsen, with additional temporary measures designed to protect the health and safety of employees and visitors to county buildings and facilities.
Any other questions? Supervisor Crummery.
Thank you, Chairman. I guess I don't understand what we would fully gain by doing this, because from my visits to county facilities multiple times per day, the county staff is doing a phenomenal job at the mitigation procedures that they use at the doors, the fever screenings, the glove wearing, the social distancing, the mask requirements. I don't know how we could do a better job. They're just phenomenally screening people and making sure that we don't get any viruses to the most vulnerable at neighbors or at the government center, and with the plexiglass boards. So I don't see the benefit of this.
I can try to answer that. The one thing that's been pointed out to me is if we were to pass this, we could close the buildings down to the public again, like we did a year ago or whatever it was. And that was about the only thing that that I could see that it would change.
And based on feedback I've received, many families would pull their loved ones out of the neighbor's facility if that was to happen again.
Supervisor Rogers, I believe you had your hand up, and then Supervisor Quinn.
So I guess my concern here is when I read this, it just means that you want to take the decision making away from the county supervisors and give it to the county manager with input from the county chair and the health department. I don't understand what the goal is when the county supervisors can make the decisions. You can call an emergency meeting if it's absolutely necessary. This emergency order has no end date on it. It's vague as to when it starts and when it ends. Not sure why we even need to be considering this when you're just transferring the decision-making from the supervisors to the county manager.
Supervisor Quinn, did you have a comment?
Yes, thank you, Mr. Chair. I need to start by saying that I share the other supervisors' respect for the county health department. I think that they are really have done a great job, and the staff is working really hard. But I voted no on this resolution in executive last week, and I intend to vote no on it tonight. As far as I can see, I think it's misguided and not an essential policy that we need to adopt. It may cause more confusion and division, which is not what we need right now. As far as I can see, the policies that we have in place that came out of the initial emergency declaration, which is now expired, for county employees and for access to county facilities and buildings, are all continue to be in place, and they are part of our policy now. They are not an emergency policy, but a regular policy that is under the purview of the administration, and particularly under the Committee on Administration. So they can be changed, they can be modified through administrative action. We don't need a emergency declaration to authorize that. And I think Mr. Rogers is right in pointing out this resolution, and Ms. Crumry too, this resolution is confusing in the way it's written. But if the county wants to go beyond county activities or significantly expand county restrictions, as Mr. Rogers said, it's simple to call a meeting and have an open vote by the full board. It wouldn't, at this point in time, it wouldn't cause a problem. And I really think that's the best route to take.
I see Supervisor Larry Bjork has his hand up, but Larry, before you, let's see, I think KT is now with us on the meeting. Yes, you are. Are you there, KT?
I am. Thank you guys for your patience.
We had a question about if you could respond to the public comment letters that we had. We had about 7 of them, I think it was. Did you get a chance to see those or not?
No, I did not.
Okay. All right. Well, then I think I will let Supervisor Larry Bjork go ahead and ask his question, and then we'll hear from KT Gallagher. So Supervisor Bjork, go ahead.
Thank you, Mr. Chairman. And to start right off, I cannot support the resolution, but then I want to come right back and say that I think KT Gallagher is one of the most intelligent people I've ever met. And I think we're lucky to have her. But the things that bother me here most on this resolution, Mr. Quinn touched on it, and I see myself as a county board supervisor. I do not see myself as a paid spectator. And it seems to me that Mr. Miller would prefer to have me be a paid spectator than a county board supervisor in the direction of this county and what it does not do. And then also I think I don't know if it's sleight of hand or just, I can't think anything good about it when we keep talking about that this here only affects county board or county employees. Well, in the second paragraph, it's members of the public to county facilities. The fourth paragraph, Mr. Miller only has to consult with the chair and the health director. He doesn't have to take their advice. Also in that paragraph, it talks about visitors to county facilities. And county facilities include more than just county buildings. County facilities include the fairgrounds. Can Mr. Miller on his own say, we're going to cancel the fair? Contracts have been written to have vendors participate, and can it just be canceled because Mr. Miller thinks it's a public health hazard? And also, is this just an end around run at the racetrack? The racetrack is a county facility. Let's stand up and be supervisors. And if you think that the racetrack should be closed, vote for it. If you think the racetrack should be allowed to run, vote for it. We are supervisors. We should be able to make some of those decisions. So when this all comes around, I would request a roll call vote, and I would encourage supervisors to act as supervisors and vote your conscience, not just be a paid spectator to this resolution. Thank you.
I want to let you know that this came to me and I brought it to executive. An executive committee voted to move it on to county board. Mr. Miller did not move it on executive committee. There was a majority vote that voted to move this on to county board, and that's why it's here. Not that Mr. Miller asked for it. KT, are you ready? Could you want to give us anything, any information that you could give us, I guess?
Sure. So I think I wanted to start by saying when the COVID committee of staff that met in the morning or meets in the morning, when we talked about bringing this to the executive committee and then to the board, it was really about preventing transmission and spread among our county employees and our county buildings. We are seeing an incredible increase in COVID cases, and many folks that have been very successful at keeping themselves from getting sick are now being infected with the Omicron variant. And so that was the intention from my perspective at the health department about keeping our county employees safe from propagated spread.
Any more questions?
I have a question.
Yes, go ahead, Supervisor Lanu.
KT, this is directed at you. Basically, the precursors of increasing infections are always, or at least in most cases, visible by the testing of sewage systems. And do you have any data that says that we are increasing, decreasing, or staying the same?
Thank you for that question, Supervisor Leno. You can see that the Menominee Wastewater Treatment Facility has seen an increase in gene copies. That is also in advance of the majority of Stout students coming back. So my expectation is we have more people, we'll have more gene copies, but we are expecting to continue an increase.
Are you seeing the same, excuse me, KT, are you seeing any increases in the local rural community systems.
The local rural community systems don't feed into the Wisconsin DHS wastewater treatment monitoring.
Okay, so like Boyceville, Colfax, Elkbound, we do not have that information from them.
I do not have that data. That is correct.
All right, so just a larger town like Menominee then. All right, thank you. Appreciate the info.
Mr. Chairman,
Yes, Supervisor Story.
I have a few questions, so bear with me. And Katie, you might be able to help with some of them. First of all, I understand that this is just county building related and county employee related. However, one of those buildings would be the building where hockey takes place right now. So would we be then also telling the school district that they would not be able to have their hockey games there because of this, or is that something else?
So last year, Supervisor Story, we did have a lot of conversation with the Menominee Youth Hockey Association, and that was completely separate from the other recommendations in the county buildings. I have no expectation that this would extend to the rec center and the use that is allowed by contract with the Hockey Association.
Okay, thank you. Question number 2 would be, of all the cases that you're seeing, and they seem to be doubling or tripling weekly, and I believe you forecast that that's to continue for at least 2 to 3 more weeks, or that's the expectation. But with that, how many of those cases percentage-wise would truly be county employees that are getting it?
Sure. So my expectation is that we will be reflective of the community unless we have, as a percentage, unless we have an opportunity for spreading events among our workforce, either by gathering in offices or in other situations where people are in close contact with one another.
So you can't really say that 50% of those, 300 and some cases that are for the week or whatever, or I forgot my numbers already, but the average of 117 are related to county employees, are related to a lot more than that?
So we don't have granular data on, and this is something that maybe HR can help with if you're looking for granular data on our county staff. At the health department, we only look at the county level, and we do have folks that travel in from out of county, and so they would not be counted even as a number in our Dunn County cases.
Well, I guess what I'm looking for is how we can help county health. If it means that it's going to help with staffing issues because people are calling in sick and not able to work, if it means that they might be more inclined, whether they're sick or not, to work from home so that it doesn't affect the productivity of the departments. I guess I just want to be sure I know how this is going to help county health if there are a lot more cases that are happening as a result of other areas of the county or of the city and not just in the county government sector.
Supervisor Story, as far as working for home, we have a policy on that. We have a policy on travel. We, as I spoke before, when I looked at this, the only thing I could see that we don't have is we don't have a policy that we could lock the building down like we did a year or so ago, maybe a little over a year ago already. But that is something that this emergency declaration would give us, is that Mr. Miller, or with consulting with the other people, could decide to close the county buildings. All the other stuff, working for home, travel, working from home, instead of, encouraging it now, that stuff is all in place already.
How would we conduct county business that is necessary then? Is there a way of doing that?
Right now, we're conducting county business, yes.
But without closing down the
If we
building?
close the building, that affects how we can serve the public.
Okay. Do we see that as a
Any other
problem?
questions?
Yeah, Supervisor Kinnear.
Yes, go ahead, Supervisor Kinnear.
Thank you. If there's only one thing this would do, and that's close buildings, then I have a question related to the neighbors. The neighbors really has its own governing entity in a way that says who can visit and who can't and so forth. Would this emergency declaration allow the neighbors to be close to people, even if their governing entity said it's okay?
The neighbors has to, is regulated by a state or federal regulation. Leading age. So that's totally different than this.
So if this did pass and if the buildings were all closed, it would not apply to the neighbors. Is that what you said?
Correct.
Thank you. And I thank you, Chairman, for repeating the fact that you saw only one thing that could be done to be closing buildings. From KT or from Paul, is there something else that you see that this would give some flexibility to? Is there any other examples you could give?
Chairperson Bartlett, if I can share a little bit.
Yes, go ahead.
So Supervisor Kinnear, to further clarify the question about the neighbors, they are regulated by the CMS, or Centers for Medicaid and Medicare, and there is a strong encouragement to stay open to visitation as a patient rights issue. And so I don't see there being impact to closure because of that regulation. And then the other flexibility that I think that this does provide, and Manager Miller, please let me know if you see this differently, is that there is encouragement to work from home following engagement in high-risk activities like traveling, like gathering for weddings or funerals. But there isn't any kind of mechanism that would really be more forceful than a recommendation. And so I think that that is one area where there could be some more support to prevent transmission among county employees.
And right now, there's no authority to tell employees you have to work from home?
Yes, I believe they have decided that already, that they're recommending that they work from home if they can. Is that not true?
Thank you.
Supervisor Bauer.
Thank you, Mr. Chair. I'd like to thank you also for bringing this to us. I could understand that maybe you could have passed this without our consent. And when I first read this thing, it just didn't make sense to me. Why we're even looking at this at all? It just doesn't make any sense. The policies that the county has, very much more you can do. I mean, everything's good. I mean, the public health has done all they can and they're doing a good job. But I just can't support something like this.
Any other discussion?
I have a question.
Supervisor Vandermeulen, I believe.
Yes, it's still not clear to me what this resolution enables us to do that we can't do without it. It seems to be pretty narrowly focused on whether we could close government buildings. Can't we do that without this resolution?
And KT added that we could enforce our policies to a stricter extent, I guess, somehow. If employees didn't do what our policies recommend them to do. Is that pretty much it?
You know,
Mr. Lang?
it also, it is very narrowly focused on interactions between members of the community and county employees. But it allows temporary modifications to policies as well. For example, sick leave. It may be necessary to make some modification in order to accommodate someone being off work. It's really oriented towards the management of county staff and their interactions with members of the public in county facilities. I don't know if that answered the question, but it isn't just limited to new actions. It's, you know, or significant new policies, but also allowing adjustments to be made where necessary in order to facilitate people's need to stay home longer. Maybe their kids can't go to school. It doesn't, you know, it isn't going to create any new benefits, just an opportunity for people to have time off when county policies may not otherwise allow it.
Supervisor Calabrese, then Supervisor Quinn.
Thank you, Mr. Chairman. First of all, just for the minutes and for this resolution, if it passes, in the second whereas, it says the extreme and rapid transmission of COVID-19 at the present time constitutes a condition in the county posing an imminent threat of a disaster within the meaning of Chapter 323 of the Wisconsin. And I think it's supposed to have a statute in there or something because it just says of the Wisconsin.
Yes, Supervisor Calabrese, that was caught by Supervisor Vandermeulen earlier today. And we have modified that for the minutes as well as for the resolution. Thank you.
Yeah, that's
great. Yeah, thank you. And then at the bottom in the be it further resolved part, there's one other typo that you probably caught too. It says health director and county board chair is directed and authorized make appropriate changes. I think there's supposed to be a 2 between the authorized and the make. But that said, that same sentence, that the county manager in consultation with the public health director and county board chair is directed and authorized to make appropriate changes and exceptions to existing employee COVID and remote work policies. And I think Mr. Lang just talked about that. But that, to me, that seems to go above and beyond the, maybe I'm reading it wrong, but about the closing of the buildings and the things that were mentioned. And my question is just to clarify for me and for anybody watching, if these new appropriate changes and exceptions to existing employee COVID policies are not followed by county staff and county employees, what will happen to those county employees who refuse any changes that are made in this emergency order?
I can't answer that.
Let's see. As with all county policies that are meant to govern employee conduct, each instance of failure to follow policy has to be evaluated on its own. It is conceivable that failure to follow any policies that are implemented under the authority of this resolution could result in disciplinary action being taken. The focus right now is really on making sure that we do our part to keep the community safe when they come into our facilities and meet with the different departments and services that they get. And so a lot of this will be very easy, I think, for employees to comply with philosophically and from a physical standpoint. On the other hand, refusing to comply with work rules can have consequences. It's true.
Yeah, thank you for that. I agree with all the people who have lauded and commended the health department and the county manager and everybody else. And knowing who I know who I feel in my heart who has the best intentions. But I know Mr. Miller used the word intended, that these things are intended to do this. But, for the greater public, whether their trust is misdirected or not, that word intended gives them a little fear, and that's why they have governing bodies like us. And so I don't think I can support this, but I would be willing to have any emergency meetings and debate this as the supervisors that we were elected to be. So thanks.
Supervisor Quinn and then Supervisor Rogers.
Yeah, just a quick follow-up. I think it's true, as I understand it. We may have instituted some of the policies we're using now for COVID during the emergency period, but they're in place now, and they're board policy, and they're being administered by the county supervisors who are on the Committee on Administration. And that committee and the board has the authority to expand those policies without an emergency declaration as it seems necessary. And it seems to me like we should be focusing on how do we manage that if we do need to there is a case for expanding those policies, how we do that in a manner that follows board policy and board procedure, rather than using an emergency declaration, which really doesn't fit the situation, I don't think.
Supervisor Rogers.
I'll wait on my comments.
You wait.
I have a comment, Chairman.
Supervisor, who is this? Supervisor Jensen?
Yes.
Okay.
Yeah, I think it has room for abuse. And I think if we wanted to change it, an emergency board meeting could be brought up quickly. So I cannot support this. Thank you.
Supervisor Story.
Just one quick question. I think that one of the things was that if it passed, what criteria would there be to reopen?
I didn't understand your question.
Well, if we were to lock down the buildings, what would we use as information and criteria to reopen them again? I mean, is it going to be a change in the numbers? Is it going to be, what would mean? I would imagine then would it have to come back to us to decide to reopen them? Would it be up to you and to the county manager and KT? How would we know to reopen them? What would change?
I think that would be up to us to if we did close the buildings, then it would be up to us to reopen them also.
And in the second resolved clause, be it further resolved, it's indexed to the county's rate of transmission dropping below the high transmission rate established CDC for 7 consecutive days. So that would if that were to occur, that would automatically extinguish the emergency and the declaration.
We've been discussing this quite a while. Is there anybody that hasn't gotten to speak, would like to speak? And please speak up because I may not see your hand. If not, Mr. Supervisor Rogers, are you ready now? Because we may be voting awful soon.
Oh, yes, I guess as I read it, I question some of the policies that could be put in place. As an example, the county manager could say that all employees of the county have to be vaccinated, and if they choose not to, then he could fire them. So that's an extreme example. It's one that just come to my mind. So I certainly can't support this. Thank you.
Okay. We've had pardon?
There's been a request for a roll call.
Yes, I know that. We've had a long discussion over this, good discussion. Are we ready to vote? Anybody that hasn't been able to speak, want to speak? If not, we're going to have a roll call vote. It's been requested to have a roll call vote. So if there's no other speaking, we'll have the clerk call the roll.
On the resolution declaring a state of emergency in Dunn County, Wisconsin, and authorizing the county manager to take necessary action. Supervisor Kinnear.
No.
Supervisor Cromry.
No.
Supervisor Keeter.
Yes.
Supervisor Lenow.
Yes.
Supervisor Maves. Supervisor Maves, you're muted.
Yes. Yes.
Supervisor McCullough. He's off. Supervisor Morehouse.
Yes.
Supervisor Nihop.
No.
Supervisor Prochnow.
No.
Supervisor Quinn.
Supervisor Quinn.
Supervisor
you're muted.
Quinn.
Yes, I'm sorry. No.
Supervisor Rogers.
No.
Supervisor Score.
No.
Supervisor Steen.
No.
Supervisor Story.
No.
Supervisor Tripp.
Yes.
Supervisor Vandermeulen.
No.
Supervisor Vogel.
Yes.
Supervisor Zons.
No.
Supervisor Anderson.
No.
Supervisor Bauer.
No.
Supervisor Gary Bjork.
No.
Supervisor Larry Bjork.
No.
Supervisor Calabrese.
No.
Supervisor Hartung.
No.
Supervisor Headland.
No.
Supervisor Jensen.
No.
Supervisor Johnson.
No.
Chairman Bartlett.
No.
That fails.
Resolution fails. All right, our next county board meeting will be February 16th, 2022. And Supervisor Anderson was going to give us a little announcement on the dairy judging.
Yes, thank you, Chairman Bartlett. I learned earlier this week that the Dunn County 4-H dairy cattle judging team, if you remember, it'll be 2.5 years ago. They won, not only Dunn County won the state, then they went on and won the national, and we're scheduled to go to Scotland and Wales, other places in Great Britain to participate, represent the United States. Well, because of COVID, of course, it got postponed. And then last year, while they were training and pulling together, it got postponed again. But we kept a team together, and now we've learned this year that it is postponed again. So it looks like Dunn County will not be able to represent the United States at the world events for the 4-H dairy cattle judging contest, which is very disappointing. And I reached out to the coaches, Jim Powers and others, and they of course feel terrible. But congratulations to our Dunn County 4-H dairy cattle judging team. They stayed together and they were going to try to make it work, but it didn't. And then finally, I was asked earlier, if you remember, a few years ago, we applied to host the Allison Dairyland Finals here in Dunn County, and that would be coming up March of this year in 2022. Well, because of COVID 2 years ago, they let Walworth County have it the second year. And then they moved Dane County in ahead because they wanted to celebrate the 100th year of Allison Dairyland. And Dunn County got moved back to 2023. Well, actually, we're out now. And so Dunn County will not be hosting Allison Dairyland this year or next year. And if we're ever going to do it, it'll have to be, I guess, brought together back again from the CRT committee. So I'm sorry to make those two announcements because we were looking forward to them, but it's not going to happen. Thank you, Mr. Chairman.
Thank you. There's no other announcements. We'll adjourn the meeting.
Mr. Chairman, I got something.
Supervisor Calabrese.
Sorry, everybody. A couple months ago, I wanted to give some accolades to our departing CFO, Keith Stray. But I was advised that this would be his last meeting in January, and Mr. Miller gave me time to reconsider my accolades, and I've had, I think, 8 weeks now. And so I'd like to reconfirm those and remind everybody that according to the email, there's going to be a retirement party for Keith via Zoom on January 31st. And so I'd just like to acknowledge him at the end of this meeting.
Yes, thank you for reminding us of that. Anything else?